Cyclosporin before PCI in patients with acute myocardial infarction. Definition: Cyclosporin is a pharmacologic inhibitor of cyclosporin D. The administration of cyclosporin immediately before primary percutaneous coronary intervention (PCA) reduces the myocardial infarct size in patients with SDMI. Now, whether a single intravenous dose of cyclosporin administered immediately before PCI would improve clinical outcomes and prevent adverse left ventricular remodeling at 1 year in patients with anterior SDMI. Application in medicine. Experimental and clinical evidence suggests that cyclosporin may attenuate reperfusion injury and reduce myocardial infarct size. We aim to test whether cyclosporin would improve clinical outcomes and prevent adverse left ventricular remodeling.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 209. Immunology, immunosuppressants. What is the mechanism of action of cyclosporin? The mechanism of action of cyclosporin is to bind with cyclophilin, which is a cytosolic protein. This would form the cyclosporin-cyclophilin complex, and this complex blocks the differentiation and activation of T cells by inhibiting calcineurin. And that calcineurin in normal circumstance is what's responsible for activating the transcription of interleukin-2. So therefore, calcineurin inhibition would prevent the production of interleukin-2 and its receptors. What is the clinical use of cyclosporin? The clinical use of cyclosporin is to suppress organ rejection after transplantation, and it's also effective in certain autoimmune disorders. What are the side effects and toxicities of cyclosporin use? Cyclosporin use can lead to nephrotoxicity, hypertension, hyperlipidemia, hyperglycemia, tremors, gingival hyperplasia, and hirsutism. Define hirsutism. Hirsutism is just an abnormal growth of hair on a person's face or body.
For more information on this topic, click on the link in the description section.
The pros and the cons. Cyclosporin did not reduce the incidence of separate clinical components of the primary outcome or other events, including recurrent infraction, unstable angina, and stroke. No significant difference in the safety profile was observed between the two treatment groups. Conclusion. In patients with anterior SDMI who had been referred for primary PCI, intravenous cyclosporin did not result in better clinical outcomes than those with placebo and did not prevent adverse left ventricular remodeling at 1 year.